I'm going to talk to you now about how the skills around communication developed. The reason that Birthing Better Skills developed such an extensive range of skills, both a broad range and also a deep range, was that the birth of every baby is important to each family. I can't stress that enough. The mummy wars have made it sound as though the only valuable births are the natural births, the home births, the ones with midwives. In reality, the birth of every baby is important to the family that's birthing that baby, whether it was an easy birth at home or the most tragic birth at home, or the easiest birth in the hospital or the most tragic birth in the hospital. Childbirth is infrequent, it's one-off, it is life-transforming, and it's an activity that each woman is doing with her baby. We believed, the families and I that developed Birthing Better, strongly believed that because it's an activity, we needed comprehensive skills. And how do we know what skills we need? It is because people who have had births are going, I wished I had had a skill for this, or what could I have done, or this didn't work. And people who are pregnant and looking toward their birth are going, what if? How do I? Are there ways to? So we're answering those questions. And then everything's trial and error. So let's talk about communication. Communication is a big word. So we talk to ourselves all the time. That's one form of communication. We communicate to other people. That's another form of communication. We verbally talk to ourselves. We verbally talk to other people, and we non-verbally talk to other people as well. So we had to develop communication skills around all of those factors. So what was one factor about communication to ourselves? And that's actually in one of the ebooks called The Positive and Negative Voice, and I'll do a short video about that. A lot of women will tell you that they have really negative thoughts in their heads during birth. And once again, this is part of the mummies wars and Grantley Dick Reed that said childbirth without fear, and that became a mantra. If you're not afraid of birth, you're going to have a pain-free labor. Well, for most of us, that's absolutely nonsense. And what's nonsense is that you cannot be afraid of birth and have a very painful labor. Or you can be terrified of birth and have a relatively pain-free or manageable labor. And how do we know that? Because people talk about their births if you have an interest in them and if you ask questions. So we learned very quickly in the early 70s that the mantra about fear at birth was misguided. And I did a video on the gift of fear and how we learned skills around that. So the simplest way to say it is let your mind ramble on and on and on. If you don't like it, don't like it. It doesn't matter. However, you have the capacity, once you're skilled, to put skills into every moment of your birth. I'll give you my example. I have very quick labors. I don't particularly like them. The contractions come 10 seconds apart. They're very, very intense because I dilate very quickly. And so I just go F, 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 F. That's the only thing that comes up in my mind. I just hate it. And yet, as my mind's going F, 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 because I have the Birthing Better skills, I can intentionally breathe in and expand inside my pelvis and breathe out and soften inside my pelvis. And I can do that thinking about whether the area between my sit bones is open and whether I'm tightening up any muscles or soft tissue down there, or whether I'm in a position in which I can feel that each contraction has an effective peak to it. I can do all those things during each contraction when part of my mind is going F, 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 F. I learned how to do this from the hundreds of families who used the skills before I had my second child. So that's part of nonverbal communication, is that we want to, within our own mind, know that we can have whatever feelings we have about what they're doing to us or what they're not doing to us, or how our partner is or isn't, or how we feel about the circumstance, or how we feel about what we're feeling, and we can use skills at every nanosecond once we have the skills. The issue wasn't changing the voice. The issue was that most of us lacked skills, and we want to change change that. And we hoped that ICPA was going to help change that by giving the handout of the skills-based methods to your clients and encouraging everybody to self-learn skills when they're pregnant and use those skills while they're doing the activity of birthing their baby. Then we go on to the communication with other people. How did we start developing communications with other people? It didn't come from women. It didn't come from how do we tell our care providers what we wanted at birth. Yeah, it came from the fathers, our birth coaches, who would simply say something like this. I could see she was really struggling. I reached out my hand to touch her. She turned around and glared at me and said, "Take your effing hand off me." And I took my hand off her, and then I didn't know when to touch her again. And after the birth, we felt more alienated. We don't want that. We want skilled mothers and fathers. And fathers develop the birthing better skills along with the women. So this became complex. First of all, it's really hard for women to say a lot of things in birth, and they're concentrating very hard. And so it's very difficult when something interferes with that concentration. And it's very tempting to get very aggressive about it. Leave me alone. But you don't look like you want to be left alone. You look like you're struggling. So the person who's looking at you, who can see you and can hear you, they're getting confused messages. So one is we learned that there had to be a no that was simple, and that turned out to be nonverbal. Or it could be, that worked, but there had to be a yes. That was a bit more complicated. Nodding didn't do it for most outside people. But if a woman took a man's hand and put it on the part of her body she wanted to be touched, that helped. Now, we're going to talk in another video about how touch skills developed. So the communication was often nonverbal. It was often a shake of the head or a nod of the head or put somebody's hand on you. But that hand that then went on you was touch communication and why we developed touch skills. So when we're looking at communication, we had to simplify it and everybody had to know what it was. Did it matter whether we were communicating to our care providers or not? It turns out when we have skills to birth our baby, it's easier for us to communicate with our birth providers. And why is that? Because we look and sound as though we're coping well. And that matters hugely to care providers, obstetricians, nurse midwives, lay midwives, direct entry midwives. Nobody wants to see a woman suffer in childbirth. That's the second global childbirth goal. And how do you reduce suffering? Well, nobody's really paying attention to that because skills now no longer exist. When Lamaze was very popular in the United States and multiple millions of us took those classes, we didn't have more natural births without pain or without medical care. We suffered less, but nobody was paying attention to that. So it was totally ignored, except it was seen by obstetricians and certified nurse midwives. They just couldn't articulate its success because the natural birth movement wasn't looking at that as a goal of success. We are. Make no mistake about it. Reducing suffering in birth is the second great childbirth goal. Having a live mother is the first, and recovery of the mother and the baby, short, medium, and long term, is the third. So suffering is very big on our menu. If we can reduce suffering, how women cope and manage, deal with, handle, stay on top of, and feel in control, then they can tolerate a great variation in their birth experience, both what happens inside them, what happens to them, and what happens around them, because they recognize they don't have a lot of control over those factors. The only thing that they control is how they respond moment to moment to the experience that they're having. And so it was very important to understand that when a care provider sees women in labor, that if they've come in with a birth plan that's a mile long, and they don't want this, 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 and this, and this, and they're quite anti-medical, and they want this, 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 and this, quite natural birth, and they're looking and sounding out of control, it is very challenging for those human beings who are care providers to listen to women telling them things. However, when we went into births highly skilled and using our skills, we communicated better. We could say to somebody, could you just please wait for a moment? And they would, because the way we were talking to them was a way in which they could receive it. If we were rolling around on the bed and throwing our head back and forth and screaming one way or another and go, don't touch me, honestly, they don't pay much attention to that. So communication was primarily within ourselves, primarily with the person who was helping us, our husband or other family member or friend, and secondarily the care providers. Because ultimately, when we managed and coped better and handled and felt in control, everybody could see and hear that. And that's why we have extensive communication skills.